Welcome to the Deep Dive. Today, we're diving into some seriously important legislation you sent our way.
Oh, yeah.
The Maharashtra Medicare Service Persons and Medicare Service Institutions Act of 2010.
Wow.
It's a mouthful, I know. But this act tackles a pressing issue.
Okay.
Violence against healthcare workers and facilities in the Indian state of Maharashtra.
Right.
Imagine the stress of caring for patients while also fearing for your own safety.
Yeah.
That's the reality many healthcare professionals were facing. And this act aimed to change that.
Absolutely. The situation had escalated to the point where healthcare services were being disrupted and professionals were understandably afraid to go to work.
Oh, wow.
This legislation was a direct response to that crisis.
So let's break down what this act actually does.
Okay.
Right off the bat, it lays out some pretty clear definitions.
Yeah.
Medicare service institution, Medicare service person, violence, and property.
Yeah.
It's almost like they're drawing a line in the sand saying, these are the people and places we're protecting, and this is what we consider unacceptable behavior.
And those definitions are surprisingly broad.
Okay.
A Medicare service institution, for example, isn't just your typical hospital. We're talking everything from private clinics to mobile medical units to those pop-up medical camps you see in communities.
Interesting.
Basically, any place providing healthcare services is covered.
And they didn't just stop at doctors and nurses either.
Right.
Medicare service person casts a wide net.
Yeah.
Medical and nursing students,
Yeah.
ambulance drivers, support staff. If you're involved in healthcare, you're protected.
That's right. The lawmakers wanted to make it crystal clear that this act was meant to safeguard anyone involved in providing healthcare services.
Okay.
And the definition of violence is equally broad. It's not just physical assault. It includes intimidation, obstruction, and even threats. They recognize that psychological harm can be just as damaging.
It's like they were trying to cover all the bases, thinking of every possible scenario where a healthcare worker might feel unsafe.
Exactly. And to round it all out, property includes both physical structures like buildings and equipment, as well as movable property like medical supplies and patient records. It's all encompassing.
Okay, so they've defined who and what they're protecting. But what does the act actually say about violence against these individuals and places?
Well, it states in no uncertain terms that any violence against these individuals or damage to these properties is strictly prohibited. It's not a suggestion, it's the law.
And I'm guessing there are some serious consequences for breaking that law.
You guessed right. The Act outlines penalties that include imprisonment for up to 3 years and fines that can reach 50,000 rupees.
Okay.
That's not a slap on the wrist, and it shows how seriously the government of Maharashtra is taking this issue.
3 years. That seems pretty significant, especially when you consider that assaults in other contexts might not carry such a heavy sentence.
Right, and it gets even tougher for offenders because any offense under this act is considered cognizable and non-bailable.
Hold on, break that down for me.
Yeah.
What does cognizable and non-bailable actually mean?
It means law enforcement can arrest someone without a warrant, and getting bail isn't automatic. It underscores the severity of these offenses and how committed the authorities are to protecting healthcare services.
So it's not just about sending a message, it's about actually taking action.
Exactly. The goal is to create a real deterrence, so people think twice before resorting to violence against healthcare workers or facilities.
But it's not just about punishment, right?
Mm-hmm.
The act also talks about compensation for victims.
That's a crucial piece of the puzzle. The act mandates that anyone found guilty under this law is also liable for double the cost of any damages they caused.
Okay.
This ensures victims receive financial redress for any harm they've suffered, but it's also a powerful deterrent in itself.
It makes you realize that violence doesn't just have immediate consequences. It can have a long-lasting financial impact as well.
Exactly. It adds another layer of accountability and hopefully makes people stop and think before engaging in any type of violence.
Now, there's another section of the act that caught my eye, and it seems a little out of place at first glance. It sets up something called an authority for victims of medical negligence.
Okay.
Why include this in an act focused on violence?
That's a great question, and it speaks to a broader effort to balance the needs of both healthcare providers and patients.
Right.
While this act is primarily focused on protecting healthcare workers, it also recognizes that patients need support if they experience negligence. This authority is there to help those victims navigate the legal system and understand their rights.
So it's like they're acknowledging that creating a safe and supportive healthcare environment involves protecting everyone involved.
Precisely.
Yeah.
It's about fostering an environment of mutual respect and trust where both healthcare workers and patients feel protected.
And this authority isn't just made up of lawyers. It's got experts from various fields, medical, legal, consumer advocacy, and health management. They really try to create a well-rounded approach to helping victims of negligence.
Absolutely. It's a multifaceted issue that requires a multifaceted approach.
This is all really fascinating. We've covered the definitions, the prohibitions, the penalties, and even this authority for victims of medical negligence. It seems like the Maharashtra government took a comprehensive approach to addressing violence and creating a safer healthcare environment.
Right.
But this act doesn't exist in isolation for her. It has to fit into the existing legal framework. How does it do that?
That's a key point. This act isn't meant to replace existing laws against assault or property damage.
Okay.
Think of it as an additional layer of protection specifically designed for the healthcare sector.
So it strengthens those existing frameworks and sends a clear message that violence against healthcare workers and institutions won't be tolerated. It's like saying, we're taking this seriously and we have specific laws in place to back that up.
Exactly. It's about creating a legal environment where healthcare workers feel confident that their safety is a priority.
All of this makes me wonder, has it actually worked? I mean, we've talked about what the act says, but what about its impact on the ground?
That's the million-dollar question, isn't it? Measuring the effectiveness of any law is complex.
Right.
You have to look at crime statistics, court cases, even things like surveys and interviews with healthcare professionals.
I can imagine it's tough to isolate the impact of a single law. There are so many other factors at play, right? Like public awareness campaigns, security measures at hospitals, even just general societal attitudes towards healthcare workers.
Absolutely. It's a multifaceted issue that requires a multifaceted approach. But this act was undoubtedly a significant step in the right direction.
Right.
It put the issue of violence against healthcare workers front and center and provided a legal framework for addressing it.
You mentioned crime statistics. Do we have any data on whether violence against healthcare workers has actually decreased since the act was implemented?
There have been some studies and reports analyzing the impact of this legislation. One study found that reported incidents of violence against healthcare workers in Maharashtra did decline in the years following the act's implementation. However, it's difficult to say definitively whether that decline was solely due to the act or if other factors played a role.
That makes sense. But even a correlation is encouraging, right? It suggests that the act, at the very least, contributed to a positive change.
Exactly. And beyond the numbers, there's also the qualitative impact to consider.
Yeah.
Anecdotally, many healthcare workers have reported feeling safer and more confident in their workplaces since the act came into effect. They know there are legal protections in place, and that sends a powerful message.
I bet that peace of mind makes a huge difference. It's hard to imagine focusing on caring for patients when you're constantly worried about your own safety.
Absolutely. A safe work environment is essential for healthcare professionals to do their jobs effectively. And when they can do their jobs effectively, everyone benefits.
That's such an important point. We often think of violence as a personal issue, but in the context of healthcare, it has these ripple effects that impact the entire system.
Right. It's not just about protecting individuals, it's about protecting the integrity and functionality of the healthcare system as a whole.
Now, this act is specific to Maharashtra, but violence against healthcare workers is a global problem. I'm curious, are there any other places that have implemented similar legislation?
Yes, actually. Several other countries have recognized the need for specific laws to protect healthcare workers. For example, in the United States, there are federal laws that make it a crime to assault or intimidate healthcare workers. And many states have their own laws that enhance penalties for these types of offenses.
So the Maharashtra Act is kind of a trailblazer in a way, showing that it's possible to create targeted legislation to address this specific issue.
Absolutely. And as we've seen, it's not just about passing a law, it's about creating a culture of respect and safety within healthcare settings. That involves education training, an ongoing dialogue between healthcare providers, administrators, and law enforcement.
Like a whole ecosystem has to be built around the legislation to make it truly effective.
Precisely. It requires a collective effort to create a sustainable solution.
Okay, so we've explored the details of the act, its potential impact, and even its place within a larger global context.
Yeah.
But I want to loop back to something you said earlier. This act doesn't just react to violence, it tries to prevent it. How exactly does it do that?
That's a great question. It's not about having a crystal ball and predicting every potential act of violence. It's about shifting the culture and creating an environment where violence is less likely to occur.
So how does this act create that environment? We've talked about the deterrence, but are there any other mechanisms built in to try and stop these situations before they even start?
It's about setting clear expectations and consequences. By specifically defining violence and laying out those serious penalties, the Act sends a powerful message that these actions won't be tolerated. It empowers healthcare workers to report incidents without fear of reprisal and encourages institutions to take safety and security seriously.
So it's not just about reacting after the fact, but establishing a clear standard of behavior from the get-go.
Exactly. It's like drawing a line in the sand and saying, this is not acceptable here.
Yeah.
And that can have a ripple effect influencing not only individual actions, but also the policies and procedures of hospitals and clinics.
I see what you mean. It creates a culture of respect and safety by setting those clear boundaries.
Right. Think about it. When healthcare workers feel confident that their workplace is safe and that there are systems in place to protect them, they can focus on their jobs caring for patients.
And that benefits everyone. When healthcare workers are safe, patients receive better care.
Exactly. It's all interconnected.
Wow, this has been a really eye-opening deep dive. We've explored the specific provisions of the Maharashtra Act, its potential impact, and even its connection to the global issue of violence against healthcare workers.
And what's fascinating is how this single piece of legislation touches on so many different aspects of healthcare, from patient safety to the well-being of professionals. It highlights the complexity of the issue and the need for comprehensive solutions.
It's been incredible to unpack all of this with you. It makes you realize how much we often take for granted the safety and security of those who dedicate their lives to caring for others.
It's important to remember that healthcare workers are on the front lines, often dealing with stressful and emotionally charged situations.
Yeah.
Their safety and well-being are paramount to ensuring a functioning and effective healthcare system.
This has been an incredible journey through the Maharashtra Act. It's left me with a lot to think about, especially considering the challenges faced by healthcare workers everywhere.
It definitely raises some thought-provoking questions.
Yeah.
This act offers a model for protecting healthcare services,
Right.
but could similar legislation be effective in other contexts, perhaps even in your own community? What unique challenges and opportunities might arise in implementing such measures?
That's a great point to ponder. The conversation doesn't end here. There's always more to explore, more to learn, and more to do to ensure that healthcare is a safe and supportive environment for everyone involved. Thanks for joining us on this deep dive, and until next time, keep exploring.